Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everybody and thank you for joining this session. First of all, I would like to express my sincere gratitude to be a part of Patient Safety Orientation Program. According to this year's theme of Patient Safety Day that emphasizes on improving patient diagnosis, I will present my presentation that will be about UpToDate, improving diagnosis for patient safety. So I will be walking you through UpToDate in order to show you how you can use this platform and get benefit from it in order to deliver safe and effective care to your patient. The agenda for today will be a brief introduction about UpToDate features and benefit, how to access UpToDate from within Ministry of Health e-library, how to browse the topics within UpToDate, how to use UpToDate clinical tools and Lexi drug information tool, and finally, how to earn and redeem CME from UpToDate. So, what is UpToDate? UpToDate is an evidence-based clinical decision supporting tools that written by expert clinician to be used at the point of care. UpToDate help you in many ways as a clinician or a caregiver. It improves your medical knowledge by answering your clinical question. It is associated with improving patient outcome and quality of care. I want first to show you how you can access UpToDate from within Ministry of Health e-library portal. First, you have to access MOH e-library portal. Make sure that you have an account within Ministry of Health e-library, as I hope so. Otherwise, I will be really disappointed because this issue announced many times. Anyway, logging with your username and password, as you see in the screen. Sign in. Once you log into the portal, you will go to UpToDate from the source listed. Once you log into UpToDate, this is how your screen will look like. You will see Ministry of Health Oman at the top right of UpToDate screen. You have two options, register and sign in. You will register for an account or sign in if you have an existing account. You will ask me why I need to create an account. I can start immediately, run the search for anything I'm looking for, diagnosis, treatment, whatever the case. Yes, you are right, but you will miss a lot of feathers by registering with UpToDate that we will cover later. So we'll click in register if you don't have an account. Register for an account is very simple and straightforward. This is the registration form. All you need to fill your first name, your last name. Here I want to grab your attention that you can put also first name, second name, and third name, up to you, because this what you enter will appear laterally in your certificate if you are interested in and redeem CME and getting certificate on that. You will put your email, your country, you will put Oman. You can skip the zip code, city, Beremi, practice setting role, specialty, and creating username and password. Again, verifying your password, you will get a notification code within your email. You will receiving an email with a PIN code using the email you registered here. Copy and paste that verification code and click on submit the verification, and the process of registration will be completed. Make sure that you will open the email within 10 minutes, otherwise the PIN code will be expired. Once you are a registered user, you can have many benefits of UpToDate. As I said before, you can start using it remotely. Remote access, that meaning when you go back to home or from anywhere, you can log into UpToDate from uptodate.com from your desktop browser using your username and password and log it in. You can also use it in your mobile device. From here, I have QR codes if you're interested in downloading mobile device whenever you have iOS or Android device. You can also get CME credits. You can get some personalization features such as bookmark, most viewed, and history of page you have viewed previously. Here I want to emphasize that you must log into UpToDate at least once every 90 days from Ministry of Health e-library portal to confirm that you're still affiliated with MOH Oman. Don't worry about this matter. On day 80, you will get a notification that you need to log into UpToDate from the MOH e-library portal. On day 90, the same thing. Also, you will get another reminder. If you miss those two reminders, your account will be inactive but not deleted. All you need to do is to log in again to the Ministry of Health e-library portal, access UpToDate from there, and your account will activate it and have access again. So to simplify things, I just want to make sure that you know this. The registration only via e-library portal, and once you are coming a registered user, you can access through e-library portal or via desktop browser, as I said before, UpToDate.com, or via mobile application. Verification and the re-evaluation should happen through e-library portal at least once every 90 days. يعني تقريبا 4 times a year. Now I'm going to move to UpToDate home screen, and I'm going to start navigating the home of UpToDate. As I mentioned, if you're accessing from your e-library portal, you will find the name of institution here, Ministry of Health Oman. You will find registered and sign in button. I'm going to put my username and password and sign in. What you see here is UpToDate home screen. You will see your naming showing like this, your CME appearing next to your name. You getting half CME credit whenever you navigating a topic in UpToDate, and you can use those CME credit as a proof of continuous medical education. And this is what I mentioned. One benefit of having an account within UpToDate is your personalization feature. You will showing your history, most viewed sections or topics that you are frequently using or accessing, and also your favorite list. One of most important things, as you notice here, the orange dot, this is telling you that there is UpToDate in this topic since your last access to this topic. So you will get latest update. This is a blue bar called clinical toolbar. From below here you will find help and training videos if you are interested in knowing more about UpToDate. In the center is a search box where you can search for signs, symptoms, treatment, procedure, drug, patient information, medical abbreviation, graphical calculators, whatever you have in your mind. Take an example of sepsis. On clicking enter, you will find a speed which display all the topics of sepsis. Once you click on all the adult topics of sepsis on clicking on adult, all the pediatric topic of sepsis on clicking on pediatric, and then patient information. You will get to see multiple topics as you scroll down, but since we want to look into particular topic, we can select which is of interest to us. Say, for example, evaluation and management of suspected sepsis and septic shock in adult is of interest of us. You can also see look into subsection. As you hover around the arrow, you can see the topic outline on selecting the subsection which is of interesting to you. When clicking in the topic, you will get to see the entire content in specific format. This format is standard across all the content available in UpToDate. There are more than 10,500 such topics in UpToDate. The editorial process of UpToDate is very rigorous, where the author writes the content, which is further reviewed by section editor, which further reviewed by deputy review, which are further reviewed by peer reviewers, and the content is absolutely updates. As you can see, the literature is done in regular basis. In this topic, it is reviewed in 17th of October. If you see this content later, you will notice the review date too early to the date since the review is done on continuous basis. Now we're going to explore clinical tools like graphics, calculators, patient education, and clinical UpToDates. UpToDate allow you to search graphics relevant to your search term. UpToDate contains more than 37,000 graphics, include videos, image, tables, and algorithms. You can bookmark that one, share it to email ID, or export it to PowerPoint ready-made slide which powered by UpToDate for your morning meeting or case of week. UpToDate provide easy access to more than 165 interactive medical calculators that allow you to enter values in commonly used formula to obtain numerical data. Medical calculators are indexed by specialty or listed alphabetically. BMI, اللي هي body mass index, is a commonly used. Let us see how it's appear in UpToDate. Filling the figures. Choose the preferring units of measure. The results are automatically calculated as information entered. The interruption is highlighted at the bottom. The calculator are fully refreshed and continually updated. Patient education leaflets are available in two packets, Beyond the Basic and the Basic. Beyond the Basic are intended for patients who are confident using some form of medical terminology, while Basic are very simple and straightforward for anyone without any medical background. You can change the languages. For example, if we choose lung disease, choosing asthma, you can change language to Arabic, and you can share it or print it and give it to your patient as pamphlet. Clinical updates. How can I get latest update in my specialty? What is going on my specialty for last 6 months? Immediately under the content from the blue bar, you will find here what new. Under what new, you will be able to find the specialty covering by up to date. Let's see, for example, what's new in primary care. By clicking on primary care, you will be able to see latest updates sorted by section. Gives you just a hint. You can see updated a few days ago. If you interest, you bookmark, or you can share to your team or department and customize the message. UpToDate Lexi Drug page is a drug decision supporting tool. It is concerned about appropriate dosing, administration, and adverse effect. We can search for the medication alphabetically, or we can type it in the search box. The monograph of medication display the same way for all medication. Based in age group, we take in consideration renal and hepatic impairment if we're dealing with a patient who is complex. We can also see information how to do dose adjustment based on age group and condition. Also, we have pediatric dosing. We have adverse reaction section. If there is any adverse effect we want to bring to attention, you can access the link. We have also drug interaction page where we can add the drug that my patient take along with herbal remedy and over-counter medication. Let's type, for example, dorvastin along with the ginger as a herbal remedy, and vitamin C as over-counter. And we can also add two more drugs to see the interaction, clopidogrel and esomeprazole. Click on analyze. As clicking on analyze, what you can see here, a list of drug interaction. We have 5 risk rate: X to be avoid combination, C to monitor therapy, D consider therapy modification, A and B no action needed from your side. If you want to know more about risk rate, you can simply click here. It will give you the page. You will display what we mean about risk rating. You can access each drug interaction. These are hyperlinked. It will take you to page that analyzes this drug interaction. You have a risk summary and patient management. I encourage everyone to read the patient management. It gives you some guidance in how to mitigate this adverse effect. The last thing I want to show you is part of CME. You get a half CME credit whenever you navigate a topic in UpToDate and can use those CME credit as a proof of continuous medical education. What you need to do at the beginning when you want to configure your CME credit type, you need to go to the settings to ensure that you have correct CME type configured, AMA, pre-category 1 credits. CME credits accredited by many regions in the world and recently also accredited by OMSB. You can redeem your CME credit by credit count or by month range. Select the credits. Category AMA, pre-category 1 credits. Then click on continue. The step 2 reflect on 1 credits. This is a reflection question. You must answer this question. You must say what's your goal and how to apply to practice. For example, diagnosis or information. Click continue. This is an evaluation. You can this is a feedback form. You can skip it. It's about all overall experience about the platform. Click on submit. Then you can download your certificate. This is your certificate, how it will be look like, and your credit had been successfully redeemed.
I'm using UpToDate because it's very useful for our clinical practice. Basically, I can search any disease, any diagnosis, any symptom. I look for treatment with the latest update in clinical studies. Everything is in one combined article that is easy to read and easy to reference.
Thank you for coming to me to share you my opinion and feedback about the UpToDate. Actually, I have a long experience with UpToDate. I use it since a long time, and I'm keeping using it because I found many benefits about this website, especially in covering all topics of medicine science in details, and also in its construction and the way that they're approaching the patients. It is a very nice and easy for doctors, and also they're covering most of the common diseases in a very fine way and very easy way for all junior and senior doctors. Other thing, they are keeping updating us about all the new information, and especially if there is any new statistical studies and new medication or any modality of treatment like that. And the other thing, also they are using algorithm, which is very nice, and you can put it in your OBD clinic and you can use it as a policy, and it is easy to follow. Other thing, the images and very informative, and they're highlighted on the clinical points, and also the image is very clear and it's informative for you, and especially in the rare disease and syndromes.